Okay, so we are live. A little context for anyone who decides to watch this video that you guys have already kind of had this discussion on research topics, and you've already submitted that video. Is that correct?
Yes.
Okay, all right. So um, you'll probably just be hearing a lot of my ideas, but I am curious um, to hear what you guys are thinking or where you're at, or even how you got to wherever limited place that you're at. I think Michaela, in a different video, you mentioned that you weren't certain what you were going to be talking about, but I will read the kind of prompt that we're going off of. We are here to discuss not having a solid idea per se, but talking about our research ideas. So I think I'm going to start with my research idea. I kind of mentioned in the last video, and let me get my notebook here. I mentioned in the last video how I stumbled across something that I was super passionate about, and I didn't discover I was very passionate about it until summer semester. And that was on understanding what between language barriers, how that kind of frames or molds the way that we give care to people that are speaking a different language than we do. And also kind of with that, exploring what people are doing already and maybe coming up with an effective solution to that problem. Whether it's creating something where athletic trainers work or have better relationships with interpreters, or maybe it's a diagnostic algorithm that is in another language that people fill out. I know there's a lot of surveys and stuff that are also in another language. See, so the passion is there and the premise of the idea is there, but I don't even really know what my research question is, I guess, is where I'm stuck.
So what are you looking to fill a gap with?
I think, and I'm trying to find my notes on this, I was initially, okay, here were the research questions I wrote down. And this was just me spitballing, probably in the middle of someone speaking. I have a really bad habit of, I get this idea and I just have to write it down. Okay, so I'm sorry if this doesn't make any sense, but my things were, I first focus on a diagnostic algorithm. Are there diagnostic algorithms out there that are another language that instead of clinicians using that diagnostic algorithm, it's an algorithm phrased in a way that's in another language, kind of a thing that athletes fill out. So you could be like, oh, okay, if I'm following this, this would probably lead me to think these suspecting things. And that would have the benefit of that would be discerning an emergency situation, or not an emergency situation. Does this person actually need to go to a doctor, or is this something that I can kind of work through myself as an athletic trainer? Something that's like that. I know that sounds a little unattainable, even as I'm saying it out loud, but imagine that you're sending every single person who speaks Spanish to a doctor instead of just putting them on an ankle rehabilitation thing, because you can't necessarily figure out if they're having a chronic instability issue, or if there's some weird stress fracture issue, or you know what I mean? We shouldn't be stuck in that position just because we're not understanding each other when there's so much access to things that help us understand each other. So that was one direction. My next direction was I was just curious how athletic trainers overcome the barriers and all of those basic things that are out there. But then I started thinking about is it more of a cultural barrier between people than it is even a language barrier? If and this is a conversation that makes me entirely uncomfortable, because even though I love culture and language, I am so nervous to offend anybody, I guess. And, I'm white, privileged, person, and I don't want that to skew anything. But I was curious, if I learned full-fledged Spanish, if we were going on with my example, are there still some barriers to trust and understanding because I'm not from that culture? Is language the only problem?
Language is not the only problem, so you're totally spot on that. But I think what you would have a problem running into with some of your, like, the diagnostic algorithm would be more so health literacy again. So
Right.
just kind of knowing what kinds of questions you could ask them that they would understand without you having to explain it further.
Right.
I do speak a little bit of Spanish just because I'm a little bit Mexican, but and I worked in an inner city school where I had mostly Hispanic children as well. And so for the most part, the students actually spoke English well enough. The parents never did. So it was one of those where my medical Spanish was not there. And so I didn't ever really want to do any of that because medical things can get very, very wildly turned around. So I think, gosh, I don't even know if your kids don't even speak English. I feel like that would be hard to do. You would definitely need, I think, at least, if not like a Spanish teacher at the school to stay with you after hours and kind of help you like muddle through some of that. I don't know how.
Well, I don't necessarily know what direction to take this.
Yeah.
You know, I'm so passionate about this, but I don't know if this is like a research. I don't know what I'd be researching necessarily, I guess. I see a problem. I have no ideas for a solution.
Yeah, and culturally, that's a culture that's not they are very closed off, and if you're not one of them, that's hard to get into. However, they don't mind questions. Like, you asking questions is not being offensive. Those sorts of things.
And I have found that. Yeah.
Right. So that's always going to get you at least a little bit further in, but
then the burden's on me asking the right questions.
Well, yes and no, yeah, too.
Is what I found, you know? Maybe that's always the burden.
I don't know where you want to take that one.
Yeah. So what are you guys thinking? Yeah, what are your guys' ideas?
Dan, do you want to go?
So can we go back to that diagnostic algorithm thing? Because that is really interesting. Because it's almost like a self-diagnostic tool, almost like a WebMD, but more specific to body region if you did it that way. You know what I mean? Like WebMD, you kind of put in your symptoms and then it kind of spits out a bunch of stuff. But if you had a flow sheet that was yes, no, but how do you do that? And there's really I can't think of any way. There's no other healthcare field that does that.
Mm-hmm.
So I don't know if that would, I don't know. It's a good question, but from a realistic standpoint, I don't know if it's achievable.
I agree. And I also think that with the amount of work, not that I'm afraid of a lot of work, that's not what I'm trying to say, but after all the work you put into it, it's not realistic, because then you'd be making a flow chart for every single joint, every single pathology, translated into words that are medical, but are also so that the lay individual could understand in a completely different language than you do, not knowing if it's translating the right way or not.
So in those patient-rated outcome measures, there's a few that are valid in Denmark, but they're not valid in English. So some of those questions just don't translate to our English language, or vice versa. So I just don't know. And from a research perspective, I don't. Again, that's the same kind of like, are you trying to validate a flow chart? Are you trying to answer the question of, is this what we need? Are you trying to, I know you're trying to come up with a solution, but we don't even know what the question is.
Yeah, and I'm stuck there. And I know that's like the worst part, to be stuck. I'm stuck on the question. I don't really know. I would like to study something about, I think I would like to study, and that's what I ended up coming down to, is I want to study the Mexican culture. Because like Michaela said, I have felt in in both just my living life, you know, I've been surrounded in and immersed in that culture, kind of, I guess not immersed. I grew up in a town that was like, or in a school that the population was 60% Mexican, 40% Caucasian, and that was it. Okay, so I've been surrounded by it, and you know, still not really, not realizing there was a barrier, and also not understanding that we are different. You know, I just kind of went through life thinking like, oh, well, they're not any different than I am. You know, and then I realized that I wasn't really paying a tribute to how different they are. And now that I'm working with them, when I was going through my undergrad, I felt like they took the time to teach us some things about like Asian cultures and even some African, you know, or even it kind of went into religions, you know, how you would treat someone with different religions and faiths and how that changes your care and what they respond to. But there was never really a discussion about how in not just the Hispanic culture, but the Mexican culture, how it's different. And I'm even with on top of a language barrier, there's a lot of things that I'm facing, barriers that I'm facing, where I don't find them very committed to rehab, and I don't find that they follow up, and I don't find that they really care to explain, you know, themselves. And I don't feel that that has to do anything to do with the fact that I can't understand them, even if they could explain. Because when I've gotten a translator, we've still faced those same barriers. So, but then I get stuck on the question again. What is my question? What's the Mexican culture about?
So I think you could take this in two different directions. You could do a qualitative study on athletic training perceptions of Hispanic patients and get their sense of the things that you're saying, their how well they
Adhere
to exercise programs, self-care,
Yeah.
how well they express themselves. And the other side of that is you could do a study on a survey of Hispanic patients, and you
I think I want their perception.
Right. So what's their perception of who their athletic trainer is, and what services they think that the athletic trainer provides, and why gosh.
See, so this is where you're kind of going to run into a little bit of a cultural issue anyways, just because they swear up, down, and sideways about like icy hot and stupid stuff. Like, you know, I had somebody talk about like red thread that their parent would put on their forehead for different things, and
egg
being
cleansing,
like a wasp, like
yeah,
like random stuff like that. So you get into a lot of old wives' tales with those sorts of things. So I don't know, maybe, and this is kind of completely different from what Dan just said, but maybe going into like health literacy with different cultures and like how they kind of perceive what they need to be doing and what's going to solve a problem maybe, and how they should be doing that. Or, and this one's more about you, I guess, kind of helping to translate maybe, but, and I don't know enough about this, and this was something that I said, I think, in my like lower extremity video for Dr. Rivera, but the telemedicine.
Yeah.
So being able to do telemedicine with somebody that actually speaks their language, that they can talk to right then, right there, and you guys can kind of have a continuity of care that actually does something and goes somewhere, as opposed to just having a translator one day and then not being able to get a translator the next day.
Right, because it'd have to be every day.
Right, yeah. But, you know, like, so those were my kind of two different.
Yeah, okay, I like those, yeah.
Yeah,
I like both of those ideas.
I really like that telemedicine idea. Get a sense of what resources, maybe what resources do athletic trainers have for cultural barriers.
Okay, I like that.
And then from there you build on that to telemedicine and interpreters and Hispanic practitioners. So that might be That might be it
Yeah.
for you. Yeah.
So that would be a really great to do a solution type of, but I do like studying. I am very still interested in the studying. I think, and that's my personal question, I guess. I
Yeah, that
hate
would
being
be
curious about something and having no access to answer those curiosities, I think.
So I think if you were really interested in something like that, maybe talking to I don't know what the profession would be called, like anthropologist, maybe, where they talk about culture and the historical references to why an egg wash is what it is, and why they are so um, why they're so still using icy hot and all that stuff, and why is that. But I don't know if that's really a question that
A
we
research.
should be answering. It might be something more in a different field.
Yeah.
I think it's a good thing to know, but
Mhm.
for if you're passionate about it, by all means, don't let me try to push you one way or the other. But I think that trying to find a solution to the language barrier and health literacy would be a lot more useful to the profession than why are Mexican Americans less likely to follow through with care.
Yeah. Okay. All right. So I want to hear your guys' ideas. What are you coming up with?
Go ahead, Mikhail.
So I was the person that really had like next to no idea. I had written some things down, but nothing that was really like great. So when we started talking about it, I did look a little bit further and kind of do a little bit more research since we had our talk dance, so that way I could kind of narrow stuff down. But I wanted to look into kind of like sleep and recovery rates and things like that. And we had talked about being able to find like a sleep center, and I actually did find out that there's quite a few in Dallas, which I shouldn't be surprised about, but I am. But it was a little bit too much about like jet lag and insomnia and like sleep restriction kind of stuff. And I don't know that I necessarily wanted to go into a sleep disorder. So I don't know how applicable that would be for any of this kind of stuff. And we had talked in our group about like being able to get a survey of kind of sleep habits of adolescents and just kind of essentially doing retroactively then once you got these habits, how quickly people weren't coming back to their sport and like all that sort of stuff. But I just don't know how feasible that is, and so that one I kind of threw out. I had talked about anxiety levels. So my students are very high stress and they're very high strung, and academics is very rigorous at my school. So they're already prone to being just like super anxious and stressed out. And so like their anxiety level then goes through the roof when they have an injury and they can't participate in their sports, and kind of where their anxiety levels were and things like that. And so there are quite a few actually questionnaires on what they call it is achievement emotions. So it talks about during class and like while they're doing studying and like taking tests, they're gauging their different levels of like anger and boredom and enjoyment and, you know, like engagement, those sorts of things. So they do have questionnaires for that. Most of them seem fairly valid actually, if I really wanted to go that route, but it is definitely more of a psychological route than it is athletic training, maybe. I don't know. And it would only be applicable to a handful of, I don't know. I don't know exactly where all of that's taking me. And then the last one was something that we had talked about with Dr. Games, and Olivia Jackson and I also talked about it, and then we kind of have continued to talk about it, was just like the basics of healthcare protocols. And like they had talked about like the hand washing during our what is that called?
Standardized patient.
Yes, thank you. Standardized patient. And so we had talked about kind of being able to go to different facilities and sit in and see how often people wash their hands. And just kind of the feasibility of that was actually a lot easier for me, I think, here than it would be at other places, because I have so many areas around me and different kinds of facilities to kind of glom onto, I guess. But, and there are a couple things that I kind of found about just, personal protective wear just in general. And this is for like doctors, nurses, like those kinds of things. There was a study in like 2017 that they were trying to find out about protocol deviations and like self-contamination. And they basically at the end of the study were like, it's pretty common. I was like, okay, thanks.
Mm-hmm.
So that I like the idea, honestly, of the healthcare protocols that we should be doing because we consider ourselves healthcare professionals, but we honestly just don't. It goes by the wayside. So I'm not exactly sure where any of this is taking me, even with extra thought into it, but yeah.
Okay. Well, thank you for sharing. Dan, what do you got?
So I want to do a study on athletic training professionals' perception on evidence-based practice and what it is and what it entails. And what sparked it was when we did the first week of our first semester, we did the 10-year experience and less than 5 years experience athletic training videos. And when I had interviewed a woman that was an athletic trainer for 12 years, and she said, oh, those are the CEUs that we need to get 10 of to stay certified. Whereas the person who I interviewed, who had only been in school for 2 years, had a very different perception of what it was. And so my thought is to take it in 2 different routes. So first off, just get a perception of what is evidence-based practice and evidence-based medicine based on your years of experience. And then my other thought is do the same thing, except at a regional seminar. So maybe something like the NATA, or there's the Northern New England's Athletic Training Conference. Give a survey of what their perception of evidence-based practice is, take the survey back, give a presentation on it, an EBP CEU of evidence-based medicine, re-give the survey, and then 6 months later, send it back out to make sure that it was retained and how it changed, how their practice changed based on the lecture. And so my goals with it is to, first off, get all the athletic trainers on board with what evidence-based practice is, and especially patient-centered care, and understanding that it's not just research. Kind of like what in the video that we talked about earlier, Jody, with that person that doesn't think education's important.
Yes.
I think that's one of those, it's just one of those gaps of information that he just doesn't understand what we are capable of or what we could be doing or should be doing.
Mm-hmm.
And then also maybe change the way that that CEUs are managed by the NATA, because a lot of people see them as barriers. They just go to them to fulfill a requirement and don't ever change their practice, when I think that CEUs are important and they're valid in what they're trying to do, but I'm not sure they're achieving what they should be. So it'd be really interesting to see, is it? And then also, how can we improve it?
Improve or prove that it is they're changing?
Improve. Yeah, okay. Decide, okay, are CEUs doing anything for the profession other than making us spend money to go to all these seminars and events, or is it not working, and how do we make, because I think it's important. I think it's, in order to stay abreast of new information, you have to go get that information. If you're not one of those people that is going to do it themselves, then going to an event is extremely important for you. But is it really that useful if it's forced on the profession? I don't know. Does that make sense?
There's so much new information being put out there so often that, like, then this is just my personal opinion. I do get ideas from going to those conferences, But yeah, you're right. Does that really change my practice? Here's my example. In my undergrad, we did not learn about neural flossing. Like,
Yeah.
I'd never even heard of that. One of my athletic training friends, who is a DAT alumni, she brought it up to me, and I was like, I have no idea what you're talking about. And then I went to a district conference, and they gave a really quick, this is why we think it works. This is how you do it. Here's a lab, and dedicated probably like 2 hours to it. Have I used it once? Why would I? I'm not comfortable at all doing that after, an hour of lab on something shoddy that I didn't know in the first place. So unless you bought the book and all of those things, why would you? You're right. I think I like that idea a lot.
Yeah. And my final thought on it is I see this huge divide between young professionals and more experienced professionals, and we just can't have that in the profession. We just can't. We're too small. We're already fighting too many battles to be thought of as true healthcare professionals, and we just have to be more united than we are. And I think the way that we bridge that gap is education, and have talks and try to bring people together and on a common ground, because there is some validity to, you've been practicing for 15 years and you haven't killed anybody yet. So good for you. But there's also validity. You can't just see someone that's been out of school, that just got out of school, as they're really green behind the ears. They don't know what they're doing, because they probably have more up-to-date and better techniques than you do, even though you're applying your skills and your experiences. Why aren't we talking together in the same room? So that's where I really, at the end of it all, this is my professional goal, as like just me personally, is to bridge, to get the profession to get more together.
Yeah. I don't know if this is going to help you or just going to cause another idea for you or not. To give a little context to that conversation, or some additional information on that conversation that I had with that debate I had with that fine, upstanding gentleman. So, he did not feel this was what I think I got from him. And he was a little bit all over the place. I think that, we were both getting a little emotional about what we were saying. So he wasn't very clear. Oh, this meeting will end in 10 minutes. Okay, we have 10 minutes for me to tell you this. I need to upgrade to the Pro. Anyway, his thing was that if we decide that athletic training should not be focusing on a higher education. Not that education wasn't necessarily unimportant, but that a higher education is. He did not agree with us going to an entry-level master's program. He definitely does not agree with or see the need in any way of the DAT, which, I'm not even saying our professors say that there's a need. They think that it's an opportunity, but it's not a dire need. They reiterate that over and over again. But he definitely did not think that we should be focusing on entry-level masters. And his words, nearly verbatim, were, let's see, what did he say? Athletic training was never meant to be a profession in and of itself. Athletic training, his opinion, athletic training is a segue to many other professions. And that is people's end goal. That was his opinion on athletic training.
So did you ask him, how old is he? Or how long has he been practicing? Do you know?
He's been practicing for about 30 years.
So why is he still an athletic trainer?
So, and I brought that up, and he said,
Yeah.
well, he kind of backtracked, and he said, do you realize that only 3% of people that graduate with an athletic training degree stay in athletic training? And I said, that's not true. And he was like, well, how do you know? And I was like, how do you know?
Yeah.
He came back to saying that we are not making money by just being athletic trainers. We're making money by supplementing our job with other jobs. And I am not a good example because I'm a teacher. And he's like, and that's where you make most of your money. And I said, well, that's not an athletic training job problem. That is people not paying that is not indicative that athletic training doesn't need higher degrees and higher education and advocacy. You know, me being a teacher as well should not make our profession look bad. And then I got a little emotional from being a teacher too, with respect to being an athletic trainer as well, because, you know, I got into this job because I wanted to be their athletic trainer. They lost their teacher. So then I happened to take over that too. Am I irritated about how much I get paid as an athletic trainer? Yes. As a stupid 23-year-old, I should not have taken the job for what they're paying me. And that's something that I continue to advocate for and bring to their attention. It's a yearly thing that I'm bringing up. But I was disheartened to hear that there's any athletic trainer out there that says that our job is only meant as a stepping stone to other jobs and isn't a job in and of itself. Because what the I doing for 25 hours after school, you know, a week? You know, what's happening there? So I wanted to bring that to what you were saying.
So I was going to be one of those people that was going to use athletic training as a stepping stone, because I was getting into a doctorate of physical therapy program and decided to not pursue that because I was very passionate and really enjoyed what I was doing as an athletic trainer. Mm-hmm. My best friend's parents, both his parents, are physical therapists, and this sounds like they're about the same age as the gentleman that has the same thoughts you have. Mm-hmm. And when I was in the pre-physical therapy program, Bruce, one of the parents, asked me, what do you think about getting a DPT? Because it was right when they were making that transition. Yeah. And he thought that it was to drive up student loans so that it would reduce the number of graduates.
This is verbatim what he said.
And it would increase the need for more physical therapists, to increase the salary of physical therapists. So there's something there that either a generational or an experience that they have.
He used that exact phrase.
They almost automatically think that the negative of it, whereas our generation has been pushed so hard to go to school, get your education. Like trade schools they're doing well now, but they weren't when I was going in school. So there's some disconnect there that I don't understand. I'm not sure I ever will, but I would really love to sit down with that gentleman and just have a conversation about what do you see as a threat to you that's making you think that me getting my doctorate is a negative thing for the profession? Mm-hmm. And why do you think that the profession is a stepping stone or a lesser profession compared to whatever stepping stone other people are going to? Mm-hmm. So
I would love to give you his contact information.
So I'm not going to take it right now, but because I feel like that would be he would almost feel targeted. Right. If I got that information and kind of was like, hey, can we have a conversation? But maybe having your district director or even your state president talking to this individual might be the way to go, because he obviously, if he's not promoting the profession in a way that he should be, then
well, and I don't think you can fault him for that. You know, we can't. Are you advocating for being an AT? You know, I don't think that you can. There's nothing you can do about it. But it just, when they brought it up at DAT, when our professors brought it up at DAT weekend, when Dr. Eberman was like, there's people out there that don't believe that we should, be advancing in education. I was like, why? Why would you say, no, stop reading, stop researching? That just seems so backwards to me. And this guy, because of, whatever, wherever his opinion was coming from, gave it a real shined a real light on, that they believe that way.
So I have the exact opposite of that, because I'm an athletic trainer at a secondary school where there's 2 of us and neither of us teach. We were full-time. We're at a small school technically. And I went through an entry-level master's program. So I did not start out as an athletic trainer. That was not something that I've done forever. And so I'm the person probably that should be, kind of looked down on or hated on or whatever, because I don't have my 4-year degree in athletic training. And that's not something that I did for an extended period of time. But I don't feel like coming out of that I wasn't ready or prepared for any of the things that kind of came my way. I mean, I went to a D1 university right after school. So it was just like, I worked football and I was the only person with baseball. So, I was just like, I'm the exact opposite and the exact, thing that would be fighting against kind of his viewpoint on that.
Right.
So
that is interesting. Well, so I just wanted to bring that to you with your, as you're building your research question, Dan, that was kind of a real example that I had of that specific conversation that kind of bothered me at DAT weekend.
And that exact person is who I want to reach, and who I want to understand where are the NATA and where we are trying to go with the profession. We don't want to be a stepping stone. We don't want to be seen as a stepping stone. We want to be seen as healthcare professionals, a legitimate program, and
a purpose, purposeful.
Yeah. We're a profession, and you can make a healthy living doing what we're doing. Mm-hmm. And we should be. Yes.
You're right. I'm going to stop the recording because I think we've kind of reached our things, but I'm going to stay on here because I want to add one more final thought. And this time I'm not just going to jump off.
Sure.
Let me see.
I'll believe it when I see it.